Good morning. I just wanted to come on here to talk a little bit about some new things that's going on. I have been dealing a lot more with the increased pain from fibromyalgia. And so this video is going to be giving you some updates on some new recommendations from my doctor. Recently, I visited my primary care doctor after seeing my rheumatoid doctor, and they suggested that I give physical therapy a try. So for the next couple of weeks, I will be giving you updates on how the physical therapy is going. I started physical therapy on Monday, which was the 27th. And so I'm going to have to start out with 3 days a week and just kind of see if there's going to be any progress. If there's any progress made or no progress made, I will next step have to go and do the MRI to try to get some looks and scans done on my back, on my lower back, because they're saying something about some type of disc disease. And so, because I have some numbness down the sides of my leg on the left side, which is kind of gets worse with movement. And so they just kind of want to look, but I know with insurance they have to go through these different steps before they will allow you to have an MRI done. So for the next 4 to 6 weeks I'll be doing physical therapy. Monday was kind of intense, but I did get some good feedback from my physical therapist, kind of some additional insight on some things I should be doing and some things I should not be doing. So I'll keep y'all posted on how it's going. If you have any questions or things that you would like for me to share about my experiences with physical therapy, feel free to ask them in the comment section. This is going to be something new for me because I have a lot of pain with movement. When I wake up in the morning, it's probably the worst. And I'm sure that most of those of us who struggle with fibromyalgia know that mornings are very, very hard. And then again, kind of late at night, it's hard. Sometimes I wake up out of out of sleep due to the pain that I experience. So, and sometimes I don't even go to sleep because of the pain. So it's just a kind of touch and go thing with fibromyalgia. But I do want to share with you all how it's going. And if any of you have tried physical therapy, kind of tell me how it's been for you, because moving those joints. Oh, she did tell me about, instead of using a heat pack, it's better to use a cold pack. So I did like 15 minutes of the cold pack. That was kind of something to get used to in therapy, because I always thought it was just better to do a hot heating pad. And she said that, excuse me, she said that with the cold pack is very good for reducing inflammation, and that's one of the things that we need to focus on with fibromyalgia and chronic pain, is to reduce inflammation. So that was something good that I did learn. And so I also have had to add in doing these upper body stretches, and that was kind of difficult a little bit of getting used to. So once again, I will keep y'all posted on how the physical therapy is going. I'm keeping positive thoughts about it, and I hope to encourage somebody else to be positive, because a positive mindset and attitude is very influential on how your body responds to things. So we need to keep a positive mindset. And I know sometimes it's very hard to be positive when you have such negative pain, because pain is negative. Pain hurts. Nobody likes being in pain. So I hope that I've said something today to give you some insight and encourage you. And you can tell me something to encourage me, because it's not easy walking around in pain all day, even though a person looks good. Don't ever assume how they're feeling, because my motto is to look better than I feel. If I was going off of how I was feeling, I would not get up and do anything. I would just lay around all day, which laying around does not help. It actually makes the condition worse. So we have to get up and push past the pain. And especially when you're a mom and active in your family and home and church, you have to get moving, because if you don't, then it only gets worse. So I will come back and update you on how it's doing. My next visit will be on tomorrow, where I'll go back and try it again. And I'm just kind of waiting to see how it goes. I did have some extra aches and pains, I think, the following day, but I don't really know if that's what it came from, if that's just was going to happen anyway. Especially since my surgery, I noticed some extra pains in my stomach, which she did say that I may have scar tissue, and so I may notice some pain from the stretching of those muscles that have kind of been tensed up. So anyway, thanks for watching, and feel free to come in, ask questions, and do not forget to hit the thumbs up button and subscribe. Be encouraged and encourage somebody else.